Now we will open the abdomen in layers. This is the skin of the anterolateral abdomen. When we open the skin, then we will encounter the subcutaneous tissue. This fatty one, it is called the cambers fascia, and this membranous one is called scarbus fascia. Then we reflect the superficial fascia and we will see the muscle. This is our first muscle in the anterolateral abdomen. It is called the external oblique muscle. Okay, this muscle comes from by aid digitation from the lower 8 ribs, just lateral to their anterior ends. The direction of muscles, as you can see here, it is the downward and forward like this. It passes in the same plane as the external intercostal muscle. This part of muscle is fleshy part, and this is the external oblique aponeurosis. This is the aponeurotic part. And this again in the lateral or in the left side. This is the aponeurosis of the external oblique, and this is the fleshy part. The fleshy part will insert in this structure. This is the iliac crest. In the anterior half of the outer lip of the iliac crest, we have the insertion of the fleshy part of the external oblique muscle. Then we would like to know the marking of the aponeurotic part. If we put a line, here is the umbilicus. From the umbilicus up to the anterior superior iliac spine, below this line it becomes aponeurosis. Another line is a vertical line from the tip of the ninth costal cartilage passing to the mid-clavicular line. All the medial part of this muscle is aponeurotic. This aponeurotic part will pass inferiorly and medially. Inferiorly, this aponeurosis is attached from the anterior superior iliac spine here to the pubic tubercle, forming what we call the inguinal ligament. In this side, this is the inguinal ligament. It is the inferior attachment of the external oblique aponeurosis. Then it passes in front of the rectus abdominis muscle to form one of the layers of the anterior rectus sheath. In the midline, they are meet together to form the linea alba, which is open here. The second muscle we reflect the first one is this muscle. This muscle, it's called the internal oblique muscle. As you can see here, here is the direction of the fiber, goes downward and outward like this, in the same plane as the internal intercostal muscles. This is the fleshy part, and this is the aponeurotic part. This is fleshy, and this is aponeurosis. Okay, this is aponeurosis, and this is fleshy. The fleshy part of the muscle has an origin from the intermediate zone, anterior 2/3 of the intermediate zone of the iliac crest, and from the lateral 2/3 of the inguinal ligament itself, and from the lumbar fascia. It has number of 3 origins. Then at the lateral margin of the rectus muscle, here is the margin, the aponeurosis will divide into 2 layers. One of them passing in front of the rectus muscle and the other behind it. This internal oblique aponeurosis will divide into 2 layers, and we will demonstrate it in the next few minutes. The third muscle we reflect the internal is this muscle lying in transverse plane. This is called transversus abdominis muscle. Again, it has a fleshy part and aponeurotic part. The fleshy part of this muscle has a very wide origin. It originates from the medial lip of the iliac crest, namely the anterior 2/3 of the medial lip, and from the lumbar fascia. It's also take an origin from the lateral third of the inguinal ligament, and from the 12th rib, and the inner aspect of the lower 6 costal cartilages. Here the fibers interdigitate with the fibers of the diaphragm. So this is the origin of the fleshy part. The aponeurotic part passes all behind the rectus abdominis muscle to form part of the posterior layer. This one. Okay. The fibers that originate from the inguinal ligament, this fiber of the internal oblique and transversus abdominis both form this structure. This is called the conjoint tendon. This is the conjoint tendon. Okay. This is the lateral fiber of the internal oblique. It arches above the inguinal canal, and medially it forms the conjoint tendon. The conjoint tendon then, it is a shared fiber of both internal oblique muscle and transversus abdominis muscle, inserted crossing from the front of the canal to the back medially to be inserted into the pubic crest and the pectineal line. And it is one of the boundaries of the inguinal canal, as we will discuss later on. Okay, this is the number of 3 muscles. The fourth one, actually we will open this structure. This is called the rectus sheath. This is the rectus sheath. And deep to the rectus sheath is this longitudinal muscle at both sides of the midline. This is called the rectus abdominis muscle. As you can see, this is the rectus sheath. This is the anterior layer of it, and behind is the posterior layer. This muscle takes an origin with 2 heads. One head from the front part of the symphysis pubis, it is the medial head, and the lateral head from the upper part of the pubic crest. It goes upward to be inserted in the front of the 5th, 6th, and 7th costal cartilages. Along the muscle fiber, we have this structure. This is called the tendinous intersection. Tendinous intersection. One of it is here at the level of the zibsternum. The other one at the level of the umbilicus. It is incomplete here. And there is usually one in between them. Typically, there are 3 complete tendinous intersection. There may be an additional 1 or 2 below the umbilicus. Okay. This midline white structure, it's called the linea alba. It is formed by all aponeurosis of the muscles. The last muscle to mention is this small muscle. This one, it is called the pyramidalis muscle. It is infrequent muscle that originate from the front of the symphysis pubis between the anterior layer of the rectus sheath and the rectus abdominis muscle, and both the right and left one diverge or converge to the linea alba. Okay, this is the 5 total number, 5 muscles of the anterolateral abdominal muscle, with the rectus sheath that we will discuss later, the content and the component of the rectus sheath. Regarding the neurovascular structures of the anterolateral abdominal muscles, it runs in the same plane as the intercostal spaces. Namely, we have the lower 6 intercostal vessels and nerves from the T7 up to T12. The plane, they passes between the internal oblique muscles, which is this muscle, and transversus abdominis muscle. These are vessels, and this one is the nerve. They continue the same plane obliquely, supplying all abdominal muscle. Regarding the blood supply of the abdominal muscle, it comes from the lower 6 intercostal arteries and from the superior epigastric artery, which is a branch of the internal thoracic artery, and from the inferior epigastric artery, which is a branch of the external iliac artery, and an additional supply from the lumbar arteries that comes from abdominal aorta. The innervation, all these muscles supplied by the intercostal lower 6 intercostal nerves with additional supply to the internal, this muscle. The internal, intercostal and transversus receive additional supply from the iliohypogastric and ilioinguinal nerves. Regarding the action of the abdominal muscles, the abdominal muscles has totally four group of actions. The first one, some of them will flex the vertebral column in the thoracic and lumbar region. This is namely the most powerful flexor is the rectus abdominis muscle. It flexes the vertebral column superiorly. And another action, they are depressing the costal margin or depressing the corresponding ribs. This action is mainly by the oblique muscles and rectus abdominis muscle. Another action, it aids in compression of the abdomen, as in straining or when we lift a heavy object. And here, this action is mediated by the oblique muscle and transversus abdominis muscle. Lastly, we have a protective mechanism to the abdominal viscera, which is shared by all muscle. When it contracts, it protects the abdominal viscera, and namely the small and large intestine.